just going to give some insight about the technologies that is available to work on certain areas in evaluation, injury management, recovery, maybe biochemical analysis, and sports fitness and training. So the technology is rapidly changing the sports industry, and it is well noted by the industry, and they are looking at adapting the technology in various stages of sports, whether it's evaluation, fitness, or recovery, or injury management. And we can see that this interesting, where they looked at the Great Britain, where they got how much medals based on technology, and the sports that were not involved with technology, there was a great difference. So technology has provided us with information, and this information is primarily analyzed and scrutinized and seen what is required for us and how it is going to help us. And then execution of those information is into various factors into performance and other aspects. So the future might go into using technology in prevention of injuries, treatment and monitoring progression, and improving the performance. So on any day when technology provides data, there is a clinical judgment of those data and scrutinizing of these data, and then coming into a conclusion of how much you value those data and how you interpret them, and that is a skill what a good clinician will have, and then based on that they will make their own plan. So just Bumrah coming back into action in 11 months, or Kane Williamson coming back in 6 months, were unheard of maybe even 5 years back, where we know that if there is an injury or a spinal surgery done, it might take done. Now these are people who are now using a lot of data that is available from other sources, and interpreting them and monitoring them periodically, and then getting them back into sports at the appropriate time, what they think that they have crossed all the clinical barriers and the functional barriers. So the impact of technology is such that the Olympics in 2030, they think that more records are going to be broken based on how the technology is intervening in the sports. So technology aided evaluation is evolving from isokinetic testing alone. Now there are parameters where they can divide them into sub parameters and go into minute details of finding the hamstrings and quadriceps ratio. And based on that, there are also available methods where you can even work on the training methods, where you can break it down at different stages of recovery or into the performance where you want to target them. So isokinetic testing, which is traditionally used in the ACL rehab or any rehab in that matter, is one of the acceptable testing, and it is also used in training as well as into monitoring the progression. So close kinematic testing uses the jump analysis. Now you have these machines where you can have off gravity, and then you can load based on what you want them to load, both in the concentric and eccentric. So there are parameters which you can change depending upon at what level you want that athlete to be exposed to load. Then we have something called the variable load to pain. So sometimes in the early stage of rehab, or when there is an injury, you can work on the open kinematic, where you can offload that particular angle to a very lower load so that you can complete the range. The traditional method was avoiding those ranges and strengthening, and then go on to progress to the full range. Tensiomyography is a technology that quantifies the muscle function, and you can selectively induce a muscle contraction and see how it responds. Now, this is a very interesting one, where we are going from strength to see how physiologically a muscle responds at response. So the data what you can get out of is the time delay, what happens in the contraction, and the relaxation time the muscle takes, and the maximum displacement what the muscle can produce. Now this technology will be able to adapt only for the superficial muscles that is available. So if I'm looking at a quadriceps muscle, I can isolate all 4 components of the quadriceps muscle and see what is the response for each of these muscles in terms of performance or in terms of recovery. So there are quite a few studies in the soccer where they have used this to see post ACL injuries, how they are responding. And one interesting factor is when they were able to individualize the quadriceps and the hamstring muscle, they found that the response for the muscle was delayed, and they were able to rectify that in their rehab program to get the optimal output. Anti-gravity treadmill, the technology was actually used in NASA to induce weight bearing for people over there when they don't want them to lose bone mass, and they have reversed this technology to offload the body weight and use it in the initial phases of rehab. And it was very nice to see Rishabh Pant running on the Alter G now in Instagram. So we can see that how technology is aiding him. And when we are looking at multi ligament, how and when we will be able to have them running at the way what he's been able to do now. So there are studies which says Alter G is helpful, and there are some studies where they were looking at the safety features of an Alter G in the post-operative or TKR and THR, and positive outcomes are there. So I think the future will have that this incorporated. So coming on to recovery, commonly used is the pressure pumps, the cold water immersion, and sleep. So the whole body or the partial body immersion is very widely available now in India also, and a lot of the athletes are using them. So they were looking at parameters of what all is helping over there. So they were not only the physical parameters of domes and other things, but the physiological markers were also giving positive results. And now the consensus is what could be the ideal time duration or the temperature. So that is varying about 150 160 minus 150 160 to about 3 minutes, which is good enough to have a good recovery. And another interesting finding was that people had a good sleep perceived after a cryostimulation. So when we say perceived, it could be the athlete just feels that I'm having a better deep sleep after a cryo session. So that is also one of the factors which is helping them in the recovery. Hyperbaric oxygen therapy, again, it's a debatable one to know whether it's a medical equipment or a non-medical equipment. But when I saw into the research, there is a study planned to go on to work whether it can help in the post-concussion syndrome. And there is a study now that's been initiated in Texas where they are seeing whether at stage 1, stage 2, they can have a better result. So there were few studies which were helping them, and hyperbaric studies had stopped until 2005, and there were not much publications coming out of that, but now they've initiated to see how it can help in the post concussion. Altitude training, again, it's a buzzword which been used by all kind of athletes, and there are studies which says that you can work on altitude training to get better performance with low load. So the basic concept is you're trying to put them at a different altitude level where you are suppressing the available of the oxygen, and that will means that you will be working at a very low load, but you will get a very good internal benefit of the body. So again, these are technologies that is available. Only thing is the kind of sports, and then when you want to incorporate into your season is a planning what the individual sports person will be planning of. So technology driven in sports, we need to see that is technology driven sports being helping in preventing most of our injuries, and is the sports person able to maintain a peak fitness most of the times during the season and off season, and is early diagnosis and recovery aided in the clinical situation, and how much of biomechanical analysis can technology give us more. And every technology has its own limitations, so we'll be knowing that how much we take that technology into, and adapting technology from different sports is also very important. Adapting and taking the data which is already being used in technology in different sports is also going to give us an idea how we can plan in our sports. So the take home message, technology is always going to be evolved, and the data what we compare with 5 years and now, we'll have to know that what changes has happened in the technology, the data also has to be analyzed based on that. It is always a tool to aid us and not replace us. And the parameters recommended can be changed in course of time with more and more research coming. And we have to be clinically strong to be able to use these technologies effectively. Thank you.